Hi, my name is Ajay Sheshadri, and I'm a physician that specializes in pulmonary and critical care medicine at the University of Texas MD Anderson Cancer Center. Before I start, I wanted to thank all of you, my future colleagues, for taking the time out of your day to hear me speak. And I also wanted to thank the Rice Alumni in Medicine and Rice Pre-Medical Society leaderships for giving me this opportunity. It's a tremendous gift to be able to speak to all of you all, but I'm disappointed that I'm not able to do so in person. You deserve to celebrate this momentous occasion with your friends and your mentors. But unfortunately, we have to do this by distance. But to put an Indian spin on an American saying, when life gives you lemons, make lemon pickle. Everything tastes better with lemon pickle. So savor the moment. I know it's not quite what you expected, but better things are in store. I'm a proud Rice alumnus. I graduated in 2003 from Jones College. Those were 4 wonderful years of my life. I cherish those years. They were amazing from a personal perspective and also to see my academic growth. I feel like it was yesterday. And then I went up the stairs and strained my hip a couple days ago, and that was a cruel reminder that it was not yesterday. But that's okay, because one of the nice things with age is that it does come with a little bit of wisdom and perspective. I know that a lot of you might have some uncertainty about the future as well. That's normal. We walk those shoes. But what's different this time is it's probably being amplified by the coronavirus pandemic that's really upended society across the world. I wanted to talk to you a little bit about why I'm confident that you will go on to be successful despite this. And also some suggestions on how to stop worrying and learn to love the chaos, to brazenly misquote Stanley Kubrick. We all doubt ourselves from time to time, but Rice has given you a strong foundation for all of you to be successful. Many of you are science majors, but one of the cool things over the last couple of decades is that an increasing number of medical students are majoring in non-scientific fields. All of you are going to have something valuable to contribute to the field based on your academic and personal experiences. You all will enrich the medical community. All of you are going to have something really unique to contribute as well. I was a biochemistry major, and I fell in love with science in part because I had wonderful teachers. There's a couple that I want to highlight, Dr. Michael Gustin and Dr. John Olson. I worked in Dr. Gustin's lab for 2 years, and I learned how to turn scientific principles into scientific discovery. It was really an eye-opening experience, and it sparked my love for science. Dr. Olson was a great mentor and a calm, guiding hand for many of us in the biosciences, and I can't thank them enough for setting me on this path. What separates Rice from many of the other institutions around the country is that we're a small community, but the educators, the leaders, and the alumni genuinely care about your professional growth and personal development. Every time I felt unsure of my progress or direction, I found someone to give me guidance, and that really kept me sane. It took me years to appreciate the magnitude of what good mentorship could mean. From my future colleagues who majored in something other than science, I welcome you with open arms to the medical community. All of you will learn or relearn the Krebs cycle, yeast budding patterns, obscure radiological signs, nonsensical medical eponyms, and so on and so forth. Medicine is a lot more than just science. Just like working in a lab requires the practical application of scientific concepts, good medicine requires an empathetic, caring, human touch. Your goal as a physician is to take all that you've learned in the classroom and stored and distilled and turn that into a message that you can relay to your patients in a caring and understanding manner. To do so requires us to understand human emotion and psychology, to understand cultures and beliefs. You'll learn to build trust with your patients and treasure that trust as a genuine gift. What separates us from a Google algorithm is that we understand that people need more than a diagnosis and a prescription. Sometimes you'll make a diagnosis within minutes of seeing a patient, but if you miss that opportunity to build trust and rapport, you'll miss out on a key part of what makes our profession so special. I'll give you an example. A few weeks ago, I saw a patient who saw me because of a cough. She was not having a great response to her cancer treatment, and even before I saw her, I could see from her chart that her cancer was getting worse, and almost certainly this was why she was coughing. All I was asked to do was to figure out why she was coughing, but when I saw her within a minute or two of talking, I could tell there was a lot more that was on her mind, and the cough was barely on her radar. So I asked her, "What's on your mind?" She was worried about how the pandemic was going to affect her cancer treatment. She was about to enroll in a clinical trial, and she was worried that she wouldn't be able to because of the way that medical care had been disrupted. She was worried about her grandson in college who was going to graduate but wasn't going to have a proper graduation. She was worried that she wouldn't get to celebrate her role as the matriarch of the family when Thanksgiving came around. And we talked a little bit about how little we knew what the coming weeks and months would hold. But we also reassured each other we would do our best in our own ways to make things better. She started to smile and lift the corners of her mouth. She told me, I almost didn't come see you because I didn't see the point, but now I'm glad I did. Thanks for lifting my spirits. I didn't fix her cough, but I made her feel better. I connected to her. Patients give us a window into their lives. It's a great privilege and it's an enormous responsibility, but it's one of the great joys that we have as physicians. The other privilege that I've had is the mentorship of students and physician trainees in science and clinical medicine. I've experienced the value of mentorship firsthand at Rice and throughout my career. Dr. Atul Gawande once noted the disconnect between athletes and many other professionals. No athlete achieves greatness on their own. Why would we expect that of medical professionals? Medical training can be busy and taxing, and sometimes you don't see the forest for the trees. One of my biggest regrets is in medical school, I didn't seek out formal mentorship until much, much later in my medical career when I decided to refocus on science. Once I did, I had the good fortune to meet two amazing role models for mentors. The first was Dr. Mario Castro at the Washington University School of Medicine, where I did my fellowship. He's now the chief of pulmonary medicine at Kansas University. He taught me how to be a researcher, basically from nothing. More than that, through his advice and just from observation, I learned how to develop professionally. I learned how to organize my thoughts into short and long-term goals. I learned how to build and lead teams. I learned how to construct analysis plans and write papers and grants. I also saw what a commitment was to mentor somebody and what a responsibility it was to shepherd somebody's fledgling career. When I came to MD Anderson, I had the good fortune to find an equally talented mentor in Dr. Burton Dickey, our chair of pulmonary medicine. Burton was impressed with the skills that I developed under Dr. Castro, but importantly, he helped me focus those to answer critical scientific questions for cancer patients. I still get advice from Dr. Dickey and Dr. Castro regularly, and sometimes daily from Dr. Dickey. I would not be where I am today without that great mentorship and continued guidance. When my first student asked me to mentor her a few years ago, I didn't know if I had it in me yet. Here I was just a couple years into my first faculty appointment, and somebody's putting their career in my hands. I tried to tell her she should find somebody more experienced, but she was persistent. She insisted on working on our new pulmonary telemedicine program, where we monitor lung function in stem cell transplant recipients in their homes. We took her on, and it ended up being a wonderful decision for both of us, so she had better insight than I did. Her work was crucial to our program. We helped her match into an internal medicine residency. It was a win-win situation. I've had several other students and physician trainees work with me since. They've authored papers, gotten into medical school, matched into residencies, obtained faculty positions, and so on and so forth. But what I'm most proud of is that they've developed a love for science and medicine. I help guide research mentorship at the UT McGovern Medical School, and it's a pleasure to see bright young minds focus their talents on scientific progress. But more than that, it's an immense pleasure to see their personal and professional growth. Mentorship is particularly important in this next phase of your life, because at some point, your lives will not follow well-charted paths. You've seen a taste of that in your undergraduate studies, because you can shape your training and education to fit your interests and needs. And in some ways, medical school and dental school is more structured than your undergraduate training. But after you graduate medical school or dental school, the possibilities can seem endless, which can be good or bad depending on your perspective. After having seen just a glimpse of the breadth of medicine, you're going to be asked to choose a specialty that will define the rest of your professional lives. After that, you're going to have to decide whether to go into practice, into an academic setting, or in a private practice setting, or to pursue subspecialty training, and that can continue for a long time. Figuring out what to do with all this education and training can easily consume you. That makes the trusted advice of colleagues and mentors that much more valuable. Also remember, you made it this far for a reason. You're graduating from a top school, you're going into a respected profession, and you've got support from peers, mentors, and alumni. Take these decisions one at a time as they come, and remember, if something doesn't feel right, you have the ability to make a change until it does. Don't limit possibilities for yourself until you're sure that you're comfortable with the decisions you're about to make. But also remember, nothing in life is guaranteed. Sometimes you don't have that kind of certainty and you can't expect that kind of certainty. That's okay. Let me give you a personal example. When I got into medical school, I didn't even know what an internist was. I mean, was everybody else a dermatologist? I loved internal medicine because I loved mysteries. I loved figuring out how things worked. I loved physiology. I loved engineering. And I went into internal medicine at the University of Texas Southwestern Medical Center. I figured I'd end up being a cardiologist. I mean, that was kind of what piqued my interest, but my first month as a medicine resident completely changed my life course. I was in the ICU in Parkland Hospital and I loved it. July 1st, I was a brand new doctor and I was taking care of a dozen or so of Dallas's sickest patients. It was exhilarating, harrowing, scary, exhausting. I loved the ICU, and this was the driving force for me to go to pulmonary and critical care medicine. Completely changed my entire academic focus. I had a nagging feeling, though, that at some point this might burn me out. That's a common problem in ICU medicine. I wanted to have the option to pursue academic science, so I focused my fellowship searches on places that had master's degrees in public health or in clinical science. I chose Washington University, and I realized quickly that my best fit for mentorship was Dr. Castro, who's a severe asthma researcher. I'd always considered myself as an ICU doctor ever since I had started residency, and had barely considered being an asthma doctor, but this was a golden opportunity, and it ended up being a wonderful decision. Fast forward a few years, and I had to turn this asthma training into a job, and a position became open here at the MD Anderson Cancer Center. The catch was that I'd have to turn this work into asthma into a program that would study graft versus host disease of the lung, which is a little bit like asthma, but in a lot of ways it's not, in stem cell transplant recipients. This was far from a well-trod path. There's only a handful of us around the world. But also gave me the opportunity to build something new, and that was my own. I took it, and it was one of the best decisions of my life. When the opportunity came to develop a program to study pneumonitis in cancer patients undergoing immunotherapy, I didn't hesitate. Did I know how this was going to turn out, or whether I would succeed? Not really. But what I realized is that I had built a great foundation over the years. That foundation started at Rice with great mentorship, great teachers, and a love for academic investigation. Can I tell you what tomorrow brings? No, but I can tell you you'll be ready for it. One final message to you all. The late Dr. Daniel Foster, former chair of medicine at UT Southwestern, would tell us as we graduated from medical school, when you put on that white coat, it is like a suit of armor. Put everything aside to take excellent care of your patients. Don't let anything affect you until that white coat comes off. To that message of dedication, I would add this. Take excellent care of yourselves as well. You may feel anxiety because of the coronavirus pandemic and the chaotic nature of the last few weeks that have taken their toll across the world. Know that you are not alone. We hear you, we see you, we understand you, and we empathize with you. More than anything, we are here to support you academically, emotionally, professionally. This pandemic will pass, and while it may change society in ways that we cannot predict, I know that all of you will be ready to rise to the challenge. To my future colleagues, congratulations on your achievements and welcome.